Hello, and welcome to Effectively Partnering with Rural Communities for Public Health Communications. My name is Cassandra Mohan, and I'm an Education and Training Specialist at the Population Health Innovation Lab, a program of the Public Health Institute. I'm looking forward to guiding you through Lesson 2 today. I'll start with a general overview of the course, and then we'll jump into Lesson 2. This course was developed with support from the Centers for Disease Control and Prevention, Office of Rural Health, through funding provided under CDC RFA PW 240080. CDC, our planners and content experts, wish to disclose they have no financial relationships with ineligible companies whose primary business is producing, marketing, selling, reselling, or distributing healthcare products used by or on patients. Content will not include any discussion of the unlabeled use of a product or a product under investigational use. CDC did not accept financial or in-kind support from any ineligible company for this continuing education activity. The audience for this course is individuals who may not directly work in rural settings but are involved in rural public health and seek to deepen their understanding of collaborating with rural communities to enhance public health communication strategies. Participants may include federal level or state level public health staff developing communication campaigns or policies that impact rural populations, nonprofit program managers supporting rural health initiatives, hospital system outreach coordinators working with rural communities, consultants providing strategic support to rural clinics and health departments, nurses working in rural communities, and others. This course seeks to deepen participants' understanding of how to effectively partner with rural communities to enhance public health communication strategies by building relationships with rural communities, planning, developing, and disseminating tailored public health messaging for rural audiences, and collaborating with community partners throughout the communications process. This course was developed by the Population Health Innovation Lab, a program of the Public Health Institute, with support from the Centers for Disease Control and Prevention, Office of Rural Health. What to expect in this course? We hope to deepen learners' understanding of partnering with rural communities to enhance public health communication strategies through a series of lessons featuring a combination of strategies and resources. Here, you'll find tools and approaches you can use to support your public health communication efforts. Real-world examples. Throughout the lessons, we've included scenarios and stories drawn from rural communities to help illustrate various concepts and strategies. Insights gathered from rural health community members and experts. You'll hear directly from those doing the work: rural health community representatives, public health practitioners, rural experts, and others, whose experiences informed the development of this course. We hope to deepen your understanding of what it means to partner with rural communities by sharing their voices throughout the course. These insights were gathered through a series of interviews conducted specifically for this course, and you'll see their perspectives quoted across different lessons. Integrated workbook activities. At the end of each lesson, we'll guide you to the accompanying workbook. These activities are designed to help you reflect, plan, and apply what you're learning in a way that's relevant to your work. Course structure. This course is divided into 4 lessons. Lesson 1, Building Relationships. This lesson lays the foundation by exploring the importance of collaborating with rural communities. Participants will learn why these partnerships matter and how to practice active listening and relationship building to foster trust and more effective communication. Lesson 2, Building an Initial Communications Strategy. This lesson focuses on co-developing a public health communication strategy with rural communities. Learners will walk away understanding the core concepts of strategic communications, how to assess community needs and assets collaboratively, and why rural voices are essential in the planning process. Lesson 3, Developing Messaging. This lesson dives into developing public health messaging that resonates with rural audiences. Participants will learn how to craft linguistically and contextually responsive messages and how to meaningfully involve community members in message development that addresses community health and resilience needs. Lesson 4, Disseminating Messaging. This lesson closes out the course with strategies for dissemination. Participants will identify ways to share public health messages with rural communities, such as ways to build on local leadership and promote informed decision-making, and ultimately contribute to better health outcomes. We recommend that participants complete all 4 lessons in sequence to build a solid, layered understanding of the topic. Each lesson is designed to build on the previous one. However, you're welcome to take as many or as few lessons as you want, in any order. We invite you to do whatever works best for your learning needs. Lesson 2, Building an Initial Communications Strategy. In the previous lesson, we explored the foundational concepts of building relationships with rural communities. In Lesson 2, we will now discuss how we can work with rural community partners to inform communications planning by setting goals, understanding audiences, and building an initial public health communications strategy. Let's review the learning objectives for Lesson 2. By the end of this lesson, you will be able to list the essential steps of strategic communications, identify resources to develop a rural public health communication strategy, identify strategies for collaborating with rural partners to gather information for effective public health communications, and recognize 2 reasons why using collaborative input from rural partners is important when developing a communications strategy. Here's our agenda for this lesson. We will start with an overview of the essential steps of strategic communications. Next, we will explore 2 examples from the field that highlight why it's important to understand the specific needs of rural communities and audiences before developing and delivering public health communication messages. Then we will be diving deeper to examine specific strategies and tailored resources for goal setting, understanding your audience, and building a communication strategy. And we will conclude by exploring how the key concepts and lessons from this module connect to the activities and tools included in the course workbook, allowing you to apply what you've learned in a practical and actionable way. Before we dive into the core content of this lesson, let's take a moment to pause and reflect on the following prompt. Think about a past public health communications initiative you were involved in. What were the goals of the communications initiative? And how did your team ensure they were aligned with the needs of the community and specific audience groups? Press pause and take a moment to think through this question. When you're ready to continue, press play and we'll continue with the lesson. Here we begin by introducing the essential steps of strategic communications. Number 1, goal setting. Number 2, understand the audience. 3, build a communications strategy. 4, develop messaging. 5, seek input. 6, deliver messaging. And finally, 7, review and revise. These essential steps of strategic communications have been adapted from the Population Health Innovation Lab's Powering Change curriculum. We've tailored this approach specifically for rural public health communications with a focus on partnering with rural communities. Partnering means that we are not just communicating information to rural communities, but we are working with them to plan, develop, and disseminate messages that are locally grounded and community owned. These essential steps will serve as a roadmap for approaching rural public health communication in a way that is intentional and flexible. While it offers structure, it's not a one-size-fits-all formula. We encourage you to adapt and apply each step based on the local context, roles, and relationships with rural communities. For the rest of Lesson 2, we will focus on the first 3 steps: goal setting, understand the audience, and build a communications strategy. The remaining steps will be explored in Lessons 3 and 4. Now that we have an overview of the essential steps of strategic communications, let's zoom in on how to partner with rural communities when completing the first 3 essential steps: goal setting, understanding the audience, and building a communication strategy. The information gathered in these first 3 steps will guide you as you move forward in developing and delivering the messaging across various channels to the audiences within rural communities. Step 1 is goal setting. During this step, you should consider questions such as, what are the goals of this communications initiative? And what are the reasons you are sharing this information with the community? The next step is understand the audience. Here are several approaches and questions you should consider during this phase. Determine the audience. Who is the audience? Break down the audience into smaller groups and prioritize. Specify desired takeaways. What do you hope the audience will take away from the communications initiative? What do you hope will be different because of the communication? Empathize with the audience. Assess the communication needs and preferences of the audience. Step 3 focuses on building a communications strategy. It is important to build an initial communication strategy early on to guide your work. The initial strategy should be informed by the previous findings of steps 1 and 2, goal setting and understanding the audience. The initial communication strategy will consider 4 elements: format, channel, frequency, and messenger. We'll start to build the strategy in this lesson and then revisit these ideas again in Lessons 3 and 4, providing several opportunities to refine your communication strategy throughout the course. Let's explore our first example from the field: the Pennsylvania Rural Health Farm Worker Protection Safety Program. This case study was published by the Rural Health Information Hub, RHI Hub, and does a great job highlighting the importance of understanding the specific needs of the rural community and audience before you develop and deliver public health communications messaging. You can read the full version on the RHI Hub website. The overall goal of the Pennsylvania Rural Health Farm Worker Protection Safety Program was to create an education outreach program to provide guidance to agricultural producers and farm workers on complying with the Environmental Protection Agency, EPA, regulations on the safe use of pesticides for agricultural production. The primary emphasis of this program was to provide tailored communications to help growers understand and implement the Worker Protection Standard regulation and the related pesticide safety information. A secondary focus was to use the program's outreach activities to remind growers of general farm safety dangers and share information about other lesser-known safety regulations. The program prioritized outreach efforts and understanding the audience. Program staff visited mushroom farms, orchards, Christmas tree farms, and greenhouses across the state to build relationships and establish trust with rural communities. The program identified several different audiences of focus for their communications efforts. While the overall focus was on Pennsylvania agriculture producers and farm workers, it was important to break the audience down into more specific groups based on their different communications needs. The program placed emphasis on understanding the language, customs, and traditions of the state's Anabaptist farmers, such as the Amish and Mennonite, and foreign born workers. In addition, the program recognized the need for communications materials to be hands on, visual, and job specific to be most effective for their audience. Program specialist Jim Harvey offered the following advice when conducting outreach: be honest, be concerned, and be willing to learn. A context-aware education program was developed that provided compliance and technical assistance for growers. The program provided training materials tailored to the regionally specific language, customs, and traditions of workers. The program developed a robust communications initiative, including a website that provided program brochures and access to training materials and videos for streaming. The program also developed commodity-relevant materials, such as training DVDs for agricultural workers with different job types, and also created versions for handlers in both English and Spanish. These visual training aids were developed for the following 6 agricultural specialties: mushrooms, orchards, vegetables, grapes, greenhouses, and nursery growers. Delivery of program messaging relied on trusted, in-person interactions that met people where they worked and lived. Let's check out a portion of 2 videos currently available on the program's website, which is linked here. The first video is tailored to orchard workers who speak English.
Pesticides, when used correctly, are effective tools in the battle to grow and produce quality crops. Because exposure to pesticides can make you sick, you should understand how they can enter your body and how you can reduce your exposure to them. It's important to follow the safety steps we will talk about today when it comes to the possibility of pesticide exposure. So, how can we be exposed to a pesticide? How does it enter our body to make us sick? Exposure.
Now let's take a look at a video in Spanish for mushroom workers.
Cuando se usan de manera adecuada, son herramientas efectivas en la lucha por producir cultivos de calidad. Ya que la exposición a pesticidas puede enfermarlo, debe entender cómo pueden entrar a su cuerpo y cómo puede reducir su exposición a los mismos. Es importante seguir los pasos de seguridad de los que hablaremos respecto a la posible exposición a pesticidas. Así que, ¿cómo podemos estar expuestos a pesticidas? ¿Cómo entran a nuestro cuerpo y nos enferman?
Let's take a moment to pause and reflect. Consider a rural public health communications initiative you may work on in the future. Are there partners in the rural community that you can include early in the process to help identify community goals and audience needs? Press pause and take a moment to think through this question. When you're ready to continue, press play, and we'll pick up with the next section of the lesson. Let's explore a second example from the field: the community collaboration adaptation of COPEWELL with rural Texas libraries. This example will highlight the importance of knowing the audience and planning ahead to support rural public health communications. This case study was published by the Rural Health Information Hub, RHI Hub. You can read the full version on the RHI Hub website. Led by Dr. Elizabeth K. Eager from Texas State University's Translational Health Research Center, the initiative partnered with the Texas State Library and Archives Commission to engage rural communities in disaster preparedness. The project leveraged trusted community figures to facilitate discussions by training local library directors in Pottsboro and Gladwater, Texas, as conveners. These library directors assembled local stakeholders to discuss their community's strengths and challenges, their library's role in the community, recent disaster events, and resiliency planning. The project used the COPEWELL framework to guide structured conversations and gathered input through surveys, focus groups, and interviews. This approach allowed for early identification of communication gaps, such as limited emergency messaging systems and confusion around local response plans. With this knowledge, communities were able to prioritize public health messaging improvements, such as updating contact lists for rapid alerts or seeking funding for more accessible communication tools. The proactive planning ensured that public health communications weren't just reactive, but part of a long-term resilience strategy. This project demonstrates that effective rural public health communication begins with deep community understanding and relationship building. It also shows that planning communication strategies in advance, especially during times of calm rather than crisis, can lead to more responsive public health messaging when emergencies arise. Let's take a moment to pause and reflect on the following prompt. Think about a rural community you are partnering with for a communications initiative. Who might serve as a trusted convener, like the library directors in the previous example? Why? Dive deeper and ask yourself, who do people turn to for information or support in the community? Who in the community regularly connects with a wide range of residents? Who has a reputation for listening and acting in the community's best interest? After you identify a trusted convener, write down a few sentences explaining why this person or group is considered trusted in the community. Press pause and take a moment to think through this reflection prompt. When you're ready to continue, press play, and we'll pick up with the next section of the lesson. Now that we've reviewed a couple examples from the field, let's take a look at some strategies and resources that you can use for goal setting, understanding the audience, and building a communication strategy for a rural public health communications initiative. As the examples from the field highlighted, it is important to understand the specific context of the rural community and audience you are working with when you are developing communications for rural public health initiatives. You will first need to build relationships with community partners and take the time to listen and learn. Strong relationships and trust will allow you to more effectively collaborate with community partners to set goals, understand the audience, and create a communication strategy that will resonate best with the audience. For more guidance and resources on building relationships with community partners, check out Lesson 1 of this course. Goal setting is the first step in the essential steps of strategic communications. During this phase, you are working with partners to get at the heart of understanding the reasons why you are sharing this public health information with the rural community. During this step, you should consider questions such as, what are the goals of this communications initiative? And what are the reasons you are sharing this information with the community? Your team and the various community partners you are collaborating with may have different drivers and priorities. Once you have initiated and continue to nurture your relationships with community partners, you can focus on finding alignment in the overall goal of the Public Health Communications Initiative. One way to narrow in on identifying goals is to think backwards. The 5 Whys process is a simple brainstorming tool that allows teams to move beyond obvious answers and reflect on less obvious explanations or causes. Once a general problem has been recognized, ask why questions to drill down to the root causes. Let's think back to the example of the Pennsylvania Rural Health Farm Worker Protection Safety Program. Now let's add on to this scenario and put ourselves in the shoes of the team developing the communications and educational training program. Let's imagine how we might approach the initial goal setting for this rural public health communications program. How could we adapt the 5 Whys strategy for that example? Perhaps the team would think through their goals for the program using the following questions. The team might ask something like this as their first why. Why were agricultural producers and farm workers not complying with the worker protection program? Perhaps the team discovered that agricultural producers and farm workers lacked adequate knowledge and understanding of the EPA requirements. The team might ask next, why did they lack knowledge and understanding of the requirements? Perhaps the team discovered that there was insufficient outreach and training tailored to the needs of workers. The team might then ask, why was there insufficient outreach and tailored training? Perhaps the team discovered that existing training materials were not effectively addressing the specifics of different job settings and the language, customs, and traditions of various groups, such as Anabaptist farmers and foreign-born workers. The team might then ask, why were training materials not effectively addressing these community-specific needs? Perhaps the team discovered that there was a lack of collaboration with community members to develop relevant and accessible educational resources. Finally, the team may ask, why was there a lack of collaboration in developing educational resources? Perhaps the team found that previous programs did not prioritize community engagement and customization of materials to fit the specific characteristics of different farming communities. By working through the 5 Whys, we gain a better understanding of what our goals should be for this communications initiative. The absence of tailored educational outreach and training materials may have led to a gap in understanding among agricultural producers and farm workers. We now know the path forward needs to include community engagement and customization of materials to fit the specific characteristics of different farming communities. Understanding the audience is the second step in the essential steps of strategic communications. There are several actions you should work through with your community partners to better understand the audience. First, determine the audience. Then, specify what you hope the audience will take away from the Public Health Communications Initiative. And third, empathize with the audience by assessing their needs and preferences. Determine the audience. When working to determine the audience for a rural public health communications initiative, work with your community partners to answer these questions. Who is the specific audience or audiences the initiative is trying to reach? How can you break the audience down into smaller groups and prioritize? Dr. Neetu Abad, a senior behavioral scientist at the CDC, explains the importance of breaking the audience down into smaller groups or micro communities. You can go to a rural community and you can find dozens of micro communities. So you can find any demarcation, but in many ways. You can look at racial and ethnic communities, micro communities. Sometimes there are migrant workers who are their own community within this larger community. There are Amish communities or Mennonite communities. Those are also considered rural, but a very different definition of what ties them together than just geography or numbers. When you're in that community, you always need to do a mapping of who are you talking to, who lives there, and who defines themselves and as being part of what community. A rural health partner shared the importance of understanding different demographics when thinking about specific audiences in rural communities. We also have to be very thoughtful about the different demographics in our rural communities. I know some, for example, rural hospitals that translate everything in 5 languages. And you know that isn't something that a lot of people think about in rural America. So also, just making sure the communicators know that not everyone speaks English, not everyone speaks Spanish. There are other languages in rural communities that people need to be aware are important for sharing health messages. In public health communication, practitioners don't see patients, but instead design and implement programs for audiences. The resource Health Communication Fundamentals provides a clear definition of audience for us to consider. The audiences in health communication may consist of individuals, families, or entire communities. The primary audience, sometimes called target audience, is the main audience you are trying to reach and actively engage with a health communication program. Whereas secondary audiences are indirect audiences who may be impacted by the program. You can check out the Health Communication Fundamentals resource to learn more about audiences. The Centers for Disease Control, CDC, provides a list of common public health audiences to consider when developing communications materials. In this resource, CDC explains that you can't use general public as a primary audience when using its Clear Communication Index tool because it's too broad. It is better to be specific. CDC encourages health communicators to be specific about primary audience so you can craft material that matches what the audience can comprehend and use. For example, if you're communicating with parents about vaccinating young children, choose parents of young children or parents taking children for well child visits as the primary audience, rather than all parents who may have children outside the intended age range for the recommended behaviors. Here are some examples of common audiences for public health communication materials. Consumer and non-health professional audience examples: adolescents and young adults, caregivers, community leaders. Health professional audience examples: clinicians, public health department staff, community health workers such as navigators and promotoras. Examples of other common audiences: news professionals, including online and social media outlets, nonprofit organization and foundation staff, policymakers, researchers, teachers. You can check out the CDC's list of common public health audiences to learn more about specific audiences. Specify desired takeaways. After the specific audiences have been determined for the Rural Public Health Communications Initiative, collaborate with your community partners to specify desired takeaways. Here are a couple of questions to consider. What do you hope the audience will take away from the communications initiative? What do you hope will be different because of the communication? When thinking about desired takeaways, you may want to consider which aims of health communications strategies are relevant to the Rural Public Health Communications Initiative you are working on. In RHI Hub's Rural Health Promotion and Disease Prevention Toolkit, they explain that health communication strategies aim to change people's knowledge, attitudes, and/or behaviors. For example, increase risk perception, reinforce positive behaviors, influence social norms, increase availability of support and needed services, or empower individuals to change and improve their health conditions. You can check out RHI Hub's Rural Health Promotion and Disease Prevention Toolkit to learn more about the aims of health communications strategies. Empathize with the audience. The final piece to understanding the audience is to empathize with the audience. The key to unlocking effective communications is understanding people. It is important to consider a broader context to understanding the audience. Remember that people's communications needs and motivations can be based on their lived experiences, their family, their community, and beyond. When assessing the communications needs and preferences of the audience, you may want to consider questions like, what motivates the audience? What would make the audience receptive? Why might the audience be reluctant to change or try a new health behavior? How does the audience like to receive information? And how much time does the audience have? Dr. Neetu Abad, a senior behavioral scientist at the CDC, explained the importance of understanding the communication needs and preferences of specific audiences. We were able to do this work in Amish communities. We were learning a lot about their religious and cultural belief systems and how it might influence the way that they feel about vaccines and other kinds of health services, the relationships that they have with healthcare providers, as well as their own religious and community leaders, and what role they might play in delivering or promoting a particular health service. Those insights would then help us shape services. So, for instance, we were partnering with healthcare providers who serve those communities to strengthen their offering of particular health services. Or it could be like PSAs, or for a community like the Amish, social media is not going to make sense. So, you want to do more community meetings or town hall type things. As you work with community partners to explore these types of questions to understand the audience at a deeper level, make sure to track and record this information. You will later return to your audience analysis findings to inform future communications development and dissemination planning. For more ideas about how to track and record information about your audiences, check out this editable partner examination worksheet and accompanying resources for intentional communications from the National Rural Health Resource Center. In addition to understanding your audience's needs, barriers, and motivations, it is also important to consider what they may already know about the specific public health topic you plan to focus on, what questions they may have, or where they may be most likely to receive this communication. The Public Health Communications Collaborative has created a plain language for public health guide to support public health messengers in creating messaging to advance health literacy, build trust in your organization as a source of information, and promote overall community health. Here, they provide a scenario to demonstrate how you can work through the process of defining the audience and getting specific with desired takeaways for the communications initiative. For a more in-depth look into audience analysis, check out this Audience Characteristics and Behavioral Factors template and accompanying resources for social and behavioral change communication developed by Compass. In this resource, Compass explains, an audience analysis informs the design of materials, messages, media selection, and activities of a SBCC strategy. It establishes a clear, detailed, and realistic picture of the audience. As a result, messages and activities are more likely to resonate with the audience and lead to the desired change in behaviors. This template guides you through several factors to consider as you work to understand the audience better, including demographic characteristics, preferred media and other communications delivery opportunities, current behaviors, knowledge, attitudes, and perceptions, barriers and facilitators to improved behavior. Step 3 of the essential steps of strategic communications focuses on building a communications strategy. The communications content and delivery strategy should consider 4 elements: format, channel, frequency, and messenger. The work you and your rural community partners did previously to set goals and understand the audience will help guide your process for selecting the best format, channel, frequency, and messenger. Consider the following questions as you work through the initial communications strategy. Format. How will you deliver the communications message? For example, text, video, verbal message, etc. Channel. What specific platform will you use to communicate information to reach and engage the audience? Frequency. What frequency will be best for this communications initiative considering the needs of your audience? No matter who your audience is, they are likely bombarded constantly with information. This may be newsletters or direct communications at work, or even just the news and advertisements at home. It is important to carefully consider the frequency and utility of the information you choose to share, keeping in mind that yours are certainly not the only communications that your audience will receive. Messenger. Consider who your audience trusts, who they will listen to. Depending on who you need to reach, you may not be the best messenger. Other organizations or individuals may serve as more effective information ambassadors to help ensure your messages take hold among those you need to reach. Pamela Bryant, an Associate Director for Communication, explained how understanding the audience can support effective communication in rural communities. While working in this field, I have learned that no two rural communities are alike, but there are some commonalities. Rural communities are strong. They are resilient. They have strong ties and partnerships. There is local knowledge embedded in rural communities in the form of trusted messengers and opinion leaders. We can lean into those strengths and use them as opportunities to convey important information that can reach segments of the population, including decision makers, school leaders, workforce, public health, and healthcare professionals. Using our communications expertise, we can drill down and get to the right people with the right message at the right time. Tiana Moman, a health communications fellow at the CDC Office of Rural Health, explained how working with research partners can help with understanding the audience. A consumer research partner can help figure out how rural community members like to receive their information, who they like to receive it from, whether it's a doctor or a pharmacist, or a family member or a friend, different trusted members in that community, and overall, just find the best methods for communicating information. Resource highlight: formats and channels. In RHI Hub's Rural Health Promotion and Disease Prevention Toolkit, they explain that health communication includes verbal and written strategies to influence and empower individuals, populations, and communities to make healthier choices. Using multiple communication and media formats will ensure a broader reach, but it is also important to ensure that the intended audience has access to the communication channels being used. RHI Hub shares that there are many formats to consider when developing health communications materials, including social media posts, brochures, billboards, newspaper articles, television broadcasts, radio commercials, public service announcements, newsletters, videos, digital tools, case studies, group discussions, health fairs, field trips, workbooks, and other media outlets. Several portions of today's Lesson 2 content were adapted from the Powering Change curriculum developed by the Population Health Innovation Lab. You can learn more about this curriculum at the link here. As we wrap up Lesson 2, we are now going to review the related workbook activities so that you can apply these concepts to your own work. You can use this workbook to support current and future rural public health communications initiatives. In the description of this course, we have provided a link to a Microsoft Word version of the workbook that you can copy and edit. You can navigate to various activities in the workbook using the table of contents here. During Lesson 2, we covered the first 3 essential steps of strategic communications. You are now ready to complete the matching workbook activities for goal setting, understand the audience, and build a communication strategy. Let's start with goal setting. The first activity is focused on goal setting. Here, you will work with your rural community partners to determine the goals of this public health communications initiative. Write down these goals and the reasons for sharing information in the table below. The second activity is focused on understanding the audience. In Activity 2, you will consider up to 3 target audience groups to explore for this rural public health communications initiative: A, B, and C. Work with your rural community partners to complete the tables below. The third activity will focus on build a communications strategy. In Activity 3, you will use the tables below to develop at least one initial communication strategy to explore for the Rural Public Health Communications Initiative. Strategy 1, 2, and 3. Work with your rural community partners to think through the format, channel, frequency, and messenger for each strategy you build out. Let's wrap up Lesson 2 with a brief summary and key takeaways. During this lesson, we introduced the 7 essential steps of strategic communication. We explored 2 examples from the field to better understand why partnering with and seeking input from rural community members and organizations is important. And we took a deep dive into these first 3 steps: goal setting, understand the audience, and build a communications strategy. References highlighted during the lesson are cited here and on the next slide. In addition to the resources highlighted during the lesson, here are a few more we recommend you explore to help guide your public health communications strategy. Thank you so much for joining us today for Lesson 2. If you have any questions, feel free to reach out to us at the Population Health Innovation Lab.